Another interesting abstract that I think is worth noting and pointing out is an abstract led by Steve Marin, and in collaboration with many of us as a global effort, looking at a retrospective data set of patients with gastroesophageal adenocarcinoma having HER2 gene amplification with a wide sort of criteria eligibility, whether it was by next generation sequencing or FISH, and eligible in any line of therapy, just to look at outcomes compared to what might be considered standard in each line of therapy for this disease. And it was quite interesting to see that, with this large effort, it's the largest to date looking at this subset, which is about 6% of the disease. And so it's important, I think, because it shows that line for line compared to historical control, that response rates are better, that progression-free survival in each of the lines is better, and that survival is better. And so, it's really challenging to study small subgroups of the disease. And so I think efforts like this, sort of bringing everyone together who's been able to evaluate it, even if it's only a couple of patients at each site, to look at it together, I think is quite important and suggestive to really provide optimal precision therapy to patients like these that have EGFR amplification. So I point out that abstract. I think that's an important one. And we look forward also to the publication of that data set.